Hi everyone, I am Dr. Muhammad Noor, consultant embryologist, anatomist, and histologist. Today, our session about the female reproductive system. It is divided into external genitalia, which you could be visualized from outside, and internal genitalia, which you cannot see from outside. The external genitalia include mollis pubis. What is mollis pubis? Is a fatty tissue that covers and cushions the symphysis pubis. And what is symphysis pubis? It is a secondary cartilaginous joint. Labia majora is 2/4 of skin, contain fatty tissue, and covered with hair. Located on either side of the vaginal opening, extending from the mollis pubis to the perineum. What is the perineum? The perineum is that part of the body below the pelvic diaphragm. Labia minora, 2/4 of tissue located within the folds of the labia majora. Inside the labia majora are located the labia minora. Bartholin glands, these are located on either side of the origin of the vaginal orifice, secrete a mucous substance that lubricates the vagina. Clitoris. What is clitoris? It's a short, elongated organ composed of erectile tissue, located just behind the upper junction of the labia minora. It is homologous to the penis in the male. Also, you can see the urinary orifice, and also you can see the vaginal orifice located in the lower part of the vestibule below the urinary meatus, or also known as vaginal introitus. The perineum, area of the body below the pelvic diaphragm, consists of muscles and fibrous tissue and serves as support for the pelvic structure. It's a very important. What you see is the perineum. You cannot see the perineum unless you put the patient in lithotomy position. And what is lithotomy position? This position of labor, as you can see. This is called lithotomy position. You can see the external extraction. Take a look to them. What are the pelvic viscera, which are located in the female? Located in the female, the rectum, sigmoid colon, terminal ileum, ovary, uterine tubes, uterus, vagina. And what are the internal genitalia? Internal genitalia you cannot see, cannot be visualized from outside. It includes vagina, uterus, fallopian tube, and ovaries, 2 ovaries. Take a look to here, this structure. This is sagittal section. This is sagittal section. What does it mean, sagittal section? The sections that divide the body into right and left half. This is a median sagittal section. It is called median sagittal section, the section that divides the body into right and left half. The ovary. What about the ovary? The ovary of the adult is almond shaped, and it's about 3 centimeters in length, 2 centimeters in width, and 1 centimeter in thickness. The postmenopausal side is small, of course. It lies in the posterolateral wall of the true pelvis, in the ovarian fossa between the external and internal iliac vessels. It's a location, very important, the location and the dimension. It is attached to the back of the broad ligament by the mesoovarium, or the meso means mesentery. Mesentery is a double layer of peritoneum. Mesoovarium, that is called mesentery of the ovary. The ovary is invested by the peritoneum, except at the hilum. And what is the hilum? As I did mention, the hilum is that part where the structure enters and leaves. The ovary has also suspensory ligament of the ovary, is a part of the broad ligament between the mesoovarian and the lateral wall of the pelvis. The round ligament connects the ovary to the uterus. The ovary is supplied by the ovarian artery, which is a branch from the abdominal aorta, an ovarian vein that drains in the left renal vein in the left side, and to the right side the ovarian vein drain into inferior vena cava. The uterine tube is about 10 centimeters long. It's hollow. Muscular tube is lined by ciliated coronary epithelium. Cilia is very important. This is a histology. It's lined by ciliated coronary epithelium. It is about 10 centimeters long, extending from the junction of the body and fundus of the uterus to the lateral wall of the pelvis. It consists of 4 parts, as we did mention: intramural part, isthmus, ampulla, and infundibulum. And the infundibulum, which opens the peritoneal cavity, and at the opening is surrounding by finger-like projections. They are called fimbria. And here the important part is the ampulla, that the widest part where fertilization takes place. The uterus is a hollow pear-shaped organ that thick muscular wall. It is the organ in which fertilized ova is implanted. Plantation takes place in the uterus, and the embryo grow until birth. Anteriorly, what are the relation? Anatomy is the science of relation. Anatomy is the science of relation. Anteriorly, the body is related to uterovesical pouch and superior surface of the bladder, of the urinary bladder. Posteriorly, rectouterine pouch and coils of the ileum and sigmoid colon. And lateral relation of the uterus by the body to the broad ligament and uterine artery and vein. Position, which is the normal position of the uterus. The normal position is the anteversion, anteflexion. What does it mean? This is a very common question. The long axis is bent forward nearly at right angle 90 degrees along the axis of the vagina. This angle is called anteversion. And the long axis of the body is bent slightly forward at the level of the internal os at the cervix. It's called anteflexion. That is to say, the normal position of the uterus is anteversion, anteflexion. You have to explain what does it mean, anteversion, and what does it mean, anteflexion. The reverse of this, retroversion and retroflexion, and this is found in 20% of cases and may be associated with some problems. The size of the uterus, it differs. The size varies with the age and parity. How many children do you have? This is a parity. The size of the pre-pubertal uterus is 3 centimeters long and 1 centimeter wide. In the newly paris has no children, it is 7 in length and 5 centimeters in width. In multiparis has many children, is larger, up to 9 centimeters in length and 6 centimeters in width. The postmenopausal uterus is smaller, is 5 centimeters long and 4 centimeters wide. The gravid uterus, when you are pregnant, it reaches the symphysis pubis at 12 weeks. If you find it at the symphysis pubis, when you are palpating the uterus, you find it is located. You find the uterus that is located at the level of the symphysis pubis. That means it is 12 weeks pregnancy. When it reaches at the umbilicus, means that 24th week. When it reaches external angle or joint, it is at 36 weeks. Uterine cavity, the endometrial cavity is continuous with the cervical canal through the internal os. The internal os is located between the cervix and the body. The cervix is a part of the uterus. Here, as you can see, the uterus has 3 parts: the fundus, the body, and the cervix. The cervix continues with the vagina. Blood supply and lymphatic drainage of the uterus, uterine artery from the internal iliac artery. Uterine vein drain to the internal iliac vein. Lymph from the fundus accompany ovarian artery to the para-aortic nodes at the level of L1. Body and cervical lymphs drain to the internal and external iliac nodes, but few lymph from broad ligament of the uterus through the inguinal canal, go through the inguinal canal and drain into superficial inguinal lymph nodes. The lymphatic drain is very important because for the transmission of the tumors. Metastasis, MES is called MES or metastasis. This dissemination of the tumor is called METS or metastasis.